Hello, everyone. You guessed correctly. It's time for another hypnotherapy history session. Over the last 2 weeks, I've covered the history of the great Sigmund Freud and Carl Jung. Both of these video links are in the content description below, so please feel free to check them out once we're finished today if you're interested in their work. Today, I'm going to be talking to you about another great psychologist called Alfred Adler and his Adlerian psychology theory. Please remember again that my videos are presented in a podcast format, and the background scene will not change. So let's get started by talking a little bit about who Alfred Adler was. Alfred Adler was originally an ophthalmologist, but influenced psychology by helping pioneer depth psychology and Adlerian psychology. He was an Austrian medical doctor, psychotherapist, and founder of the School of Individual Psychology. His emphasis on the importance of feelings of belonging, family constellation, and birth order set him apart from Freud and others in their common circle. He was the founder of Adlerian psychology, which was sometimes called individual psychology. He is also considered the first community psychologist because his work pioneered attention to community life, prevention, and population health. Adlerian theory purports that humans are social beings and therefore all behavior is socially embedded and has social meaning. Watts, 2000b. Adler emphasized the importance of relationships and being connected to others, including the larger community in which people reside. Adler believed that birth order had a significant and predictable impact on a child's personality and their feeling of inferiority. He believed that if people cannot compensate for normal feelings of inferiority, they develop an inferiority complex, and that all human behavior is goal-oriented and motivated by striving for superiority. Individuals differ in their goals and how they try to achieve them. I'll now move on to talk about some of Adler's theories and what some of his treatment methods were for his clients. Adler did not agree with Freud and Jung that the majority of our personality is embedded within the unconscious. He believes that whatever thoughts and behaviors are stored in the unconscious are things that we wish to avoid, evade, or don't quite understand. There are limitations to Adlerian therapy, however. One such limitation is that Adlerian therapy places emphasis on patients' early childhoods and how early childhood impacts their perspectives and beliefs. Some patients may be unable or unwilling to parse through their early childhood memories with their therapist. He suggested that individual psychology is a theory of human behavior and a therapeutic approach that encourages individuals to make positive contributions to society as well as to achieve personal happiness. Adlerian therapy is goal-oriented and is based on the principle that the patient can overcome feelings of inferiority with the help of insight provided by a therapist. The patient must overcome feelings of inferiority in order to be able to connect positively with the community. Adler was also the founder of Adlerian psychology, sometimes called individual psychology. He is considered the first community psychologist because his work pioneered attention to community life, prevention, and population health. And he defined these personality types as the socially useful type, the ruling type, the getting type, and the avoiding type. Kafir was noted as the first theorist to develop the personality priorities. Adlerian psychotherapy is both humanistic and goal-oriented. It emphasizes the individual's strivings for success, connectedness with others, and contributions to society as being hallmarks of mental health. One frequent criticism of Adlerian theory is that it does not include a comprehensive developmental model. Although Adler emphasized early childhood experiences as critical to the overall development of the child's lifestyle, he did not explicitly outline a theory of development. According to Alfred Adler, all behavior is goal-oriented. Nothing is random, and all actions have purpose. He also believed that children have a need to belong, and if that need is not fulfilled in a positive way, then they will resort to misbehavior. Adlerian therapy may be used in conjunction with other therapeutic approaches such as play therapy, art therapy, and culturally sensitive. So how did Adler apply his theories to his treatment? Adlerian therapy is an evidence-based approach that can be applied successfully in the treatment of any type of psychological or mental illness. It may also be used in conjunction with other therapeutic approaches such as play therapy, art therapy, and culturally sensitive counseling, as it best suits the needs of the individuals involved. An Adlerian approach can be employed with children, adolescents, adults, individuals, couples, families, or other groups. Adlerian therapy proceeds in 4 stages. The first stage was called engagement. Engagement involves developing the relationship between patient and therapist. This therapist is supportive, encouraging, and empathetic, which helps to forge a collaborative partnership. The pair works together to address the patient's difficulties. The assessment stage was the second part of Adler's treatment process. Assessment involves learning about the patient's past to understand their present challenges. Adlerian therapy emphasizes the influence of birth order and early childhood memories, but the therapist may also seek to understand the patient's family dynamics, important past experiences, and the nature and origins of various patterns of thought. After assessment, he would then move on to the insight stage. After learning more about the patient, insight involves uncovering why the patient acts the way they do and helping the patient to see themselves and their circumstances differently. The therapist asks questions to explore the patient's perspective and guides them toward greater awareness and understanding. The therapist may offer their own interpretations about how the patient's past may inform their present and what may be causing unhelpful or dysfunctional tendencies. The process would be ended with what is known as the reorientation stage. The reorientation stage involves change, as the therapist helps the patient develop new ways of thinking and active strategies to use outside of therapy sessions that encourage more flexible and adaptive ways of thinking and that reinforce the new insights gained in session. Overall, the focus is on reframing the attitudes, beliefs, and lifestyle choices that block success so that patients are more effective at reaching their desired goals. I'll now give you a full breakdown of the key techniques that Alfred would use in a live therapy session. Engagement and relationship building was always his starting point, and this proposed that establishing a strong therapeutic alliance is vital. The therapist creates an atmosphere of trust, respect, and collaboration. The individual should feel understood, encouraged, and accepted for therapy to be effective. Lifestyle assessment was the hallmark of Adlerian therapy. This involved the therapist collecting data about the client's early childhood memories, family constellation such as birth order, siblings, parental relationships, and major life events. These provide insights into the client's core beliefs, values, goals, and strategies for dealing with life's challenges. Early recollections were also viewed as essential parts of his treatment. Adler would ask the client to recall earliest memories. ERs are not viewed for their factual content, but for the subjective meaning the individual assigns to them. These recollections offer clues about the client's beliefs, coping strategies, and worldview. Adler also believed that encouragement is more effective than praise. Encouragement helps people see possibilities and believe in their abilities to overcome challenges. Therapists use this technique to motivate clients, boost their self-efficacy, and foster a positive outlook. He would also use a technique known as acting as if, which involves asking the client to act as if they were already the person they wish to become or as if they had already overcome a specific challenge. This allows clients to experience different behaviors, emotions, and outcomes, facilitating change. His paradoxical intention technique is used for clients stuck in a behavior pattern. The therapist might instruct them to intensify or deliberately engage in the undesired behavior. The intent is for the client to become more aware of the behavior's absurdity or irrationality, leading them to challenge and change it. The catching oneself technique was also considered to be one of the best therapy tools that Adler applied to his therapy sessions. This is where clients are taught to recognize and catch themselves when they fall into habitual, counterproductive patterns. By recognizing these patterns as they occur, clients can choose to redirect their actions or thoughts in more constructive directions. His spitting in the soup metaphorical technique makes the client's self-defeating behaviors unpalatable by highlighting the negative consequences. For instance, if a client procrastinates, the therapist might underscore the anxiety, missed opportunities, or disappointments that arise from this behavior. This was followed up with the push-button technique, which is used to highlight how individuals have control over their reactions and feelings. Clients are encouraged to visualize having two buttons, a negative which could be anger, and a positive which activated calmness. Through practice, they learn to press the positive button in situations where they typically might react negatively. Task setting and goal orientation is a process where Adlerian therapists often set tasks or homework for clients to carry out between sessions. These tasks encourage self-awareness and also provide chances to practice new behaviors and guide clients towards their goals. Role-playing was also a big part of Adler's technique, and he believed that by acting out specific situations, clients can explore emotions, behaviors, and alternative responses. It's an effective way to practice new strategies and behaviors. Guided imagery was also used and involved guiding clients through vividly imagined experiences. This can help clients confront fears, visualize successful outcomes and situations from a new perspective. As the therapy progresses, feedback and interpretation would be applied. This is when therapists provide feedback and interpretations that help clients understand their behaviors, beliefs, and feelings. This insight can pave the way for change. Adler would also use the mirror technique, where clients are asked to talk about themselves in the third person, as if they were talking about someone else. This distancing can allow for a more objective self-assessment and give insight into self-defeating patterns. That's going to bring this week's video to an end. I'd like to say a huge thank you to everyone who took the time to tune in and listen to my content. I upload videos every Monday, and I cover a wide range of different topics ranging from hypnotherapy to child psychology. So if you're enjoying the information so far, then please hit the like and share button to raise awareness about my channel, and don't forget to hit the subscribe button and bell icon if you're new.